So today we are going to talk about the toddler squat. I'm going to first demonstrate the toddler squat. So you guys understand the toddler squat is my #1 exercise for pretty much everything. So heel pain, ankle pain, hip pain, anything like that, I want you to always see if you can do the toddler squat. And if you cannot, it is a great way to help you increase your flexibility, strength, and different things like that. What's important with the toddler squat and why I want you to do it is so that you have a sign, you know this activity is difficult for you to do. Then when you do an intervention, you can try this activity, see if it is better, see if you're making any changes. So here is the toddler squat, and what it is essentially, you can see that my hips are below my knees, my toes are facing forward, my heels are on the ground, and my butt is kind of sinking back. Now when you're really good, you can lift your chest up without falling backwards. And if you want to do this toddler squat as an exercise, you essentially hold this position for 1 to 2 minutes, and you will feel a stretch, a burn, and it strengthens and lengthens your whole body. If you're having heel pain, likely the Achilles tendon, which attaches from your heel up to the back of your gastrocnemius complex or your calf muscles, that is going to be tight. So what you might see is your toes pointing out and your heels off the ground, kind of like this. So if your toes or your heels are off the ground and you go to try to bring them down, you may fall backwards and lose your balance. If that is the case, what you want to do this as an exercise is to progress towards having your heels on the ground. So you can stretch out this calf muscle and the Achilles, and also increase the dorsiflexion of your ankle, which this exercise is going to do. If you are having difficulty maintaining that toddler squat position, it is super important for you to find something really sturdy to hold on to. Something that is not going to fall on top of you if you pull back on it. For me, that is my bed. It's really sturdy. It's not going to move if I kind of pull back on it. So if you're having trouble dropping your heels, hold on to something and try to drop that butt backwards so you can kind of lean further backwards, and that is going to help stretch this area, which will then increase that dorsiflexion angle so that you can have more of an angle like this instead of an angle like this. You want these knees to be able to make a pretty hard angle here between your leg bone and your ankle bone. If that ankle is tight, that is going to throw off the mechanics on the bottom of your foot, and that can be tight because this tissue in the back is not lengthening. It can also be tight because the bones in the front of your ankle actually aren't moving the way they are supposed to. If you keep doing this and it's not improving, likely it is the joints of your ankle that are potentially causing the problem, in which case you absolutely want to look up a physical therapist, someone who is skilled in doing joint mobilizations to that ankle so that you can get movement back there, and then instead of being back here, you're able to bring your knees over that ankle and that foot can get stretched properly. Good. So far we have covered doing the toddler squat. We have a couple more, so stay tuned.